The European Union member states have taken very different approaches in the early phases of this pandemic in terms of the public reactions. However, the consequences of these actions in the countries in terms of the measures that are being followed by the populations are relatively similar between Sweden and other countries also. Um, Depending on when measures were taken and how badly the country was hit with the coronavirus in the first phase, we've seen very different trajectories in the first round. But as you rightly point out, with the map in the background, right now we are in a very seriously concerning situation across Europe.
Okay. You spoke about the different approaches there, but if we go back to March, so many European countries introduced their national lockdowns within days, sometimes weeks of each other, all with a similar approach, but yet with staggeringly different results. How do you explain that?
So I don't think the results were that staggeringly different. When major lockdowns were put in place, so essentially complete restrictions of movements, across all countries, you could see the decrease in transmission rates within 2 to 3 weeks from those dates. So the measures that are being put in place, while they are economically and socially very, very difficult to cope with, they do actually work against this disease. Now, in situations where you do partial implementation of these, the impact will not be quite as significant as with all the measures together. That's important to keep in mind. The other important thing is that the earlier these measures are put in place in relation to the transmission of your own local situation, your country, or even your city, the better effect you will have in terms of the total number of cases or the total number of deaths that you will be seeing in your environment.
Okay, you say the figures aren't that staggeringly different, but I would throw back to you Germany, which has had a relatively low casualty rate in terms of deaths compared to its closest neighbours. So is that the model to follow?
So Germany, early on in the year, they put in place good testing capacity, good contact tracing capacity, and they were lucky not to be hit in very early stages with high numbers of returning travelers, especially from Italy. So they were able to manage the situation with the normal public health practices that you need in this situation. And they didn't have escalations except for a few very local areas at that stage. And definitely testing widely, contact tracing all of those people, isolating the infected individuals, putting in quarantine the contacts of those close cases. This is classic public health activities that have been there for 100, 150 years or more. And that works, we know that, but it needs resources, it needs very early and rapid action.